Welcome to Shore Talk. Shore Talk is designed to keep you better informed of what's going on here on Virginia's beautiful Eastern Shore. Now, here's Shore Talk.
Health of the disc with nutrition or lack of nutrition in our society and how it really sets off the chronic inflammation phase. So, Charlie, you've heard the phrase, old dogs can't learn new tricks. Well, I can tell you, old Doc as in me, is learning some new tricks. So
I
had recognized, we've been doing spinal decompression on patients for 10 or 12 years now, Janet, I would say. And I, at the Virginia Chiropractic Convention, the fall convention, I think it was last year or year before last, gentleman was selling a product called Nutridisc, and it's a product that contains various nutrition, herbs, etc., to help with replenish the disc material. I started noticing when I was starting a patient out for decompression, put them on taking this. If the patient was taking this product, they seemed to get better quicker, and he sent me on our last order the actual research, and it's brand new research, and how nutrition and lack of nutrition and our diet that's full of sugar, simple carbohydrates, fat, etc., really puts the body in that chronic inflammatory stage, and that chronic inflammatory stage and our lack of proper nutrition has a whole lot to do with how healthy our discs are. So we're going to jump in that today. But first, I wanted to talk briefly about some new patients that have come in over the past 2 weeks and some interesting cases and how well they're doing. And first, I wanted to start off by thanking our current patients for the referrals they give us. One of the new patients we had over the past 2 weeks, this patient initially came in with sciatica, severe sciatica, had done medications and shots and etc. for his sciatica, and was tired of going down that road. So he had heard about us, and he finally got in, and by his second or third session on the decompression table, noticed a huge difference. The back pain was gone, the sciatica was gone. So he referred his brother in, and that's probably, Janet, I would say probably 70% of our new patients come in by referral. Wouldn't you agree?
Oh, my goodness. I mean, we had a wife come in. She said, my dad told me I needed to come in. So the next thing I know, she's in, and then her husband came in. And then we had another guy came in. Next thing I know, his wife's coming in, and now his brother's coming.
Absolutely. So a lot of our business is by word-of-mouth referrals. And word-of-mouth, as you know, Charlie, is huge here on the Eastern Shore. Word-of-mouth can make you or break you. So,
well, a gentleman called this morning and scheduled an appointment for his brother, and he heard us on the radio.
Yeah. So
he heard us on the radio.
We like to say that word of mouth begins with radio.
Right. Yeah. And that's what he said.
Absolutely.
He said, I've heard Dr. Bull talk on the radio about pain and this, and my brother has all that. He's done everything. And he said, I want him to come in. So he's coming in the morning.
Absolutely. So want to throw a thank you out there to our patients and to the ones that talk well about us and send us in referrals. Had another interesting patient came in. His low back was locked up. When he came in, he was walking with a limp, and his ankle had almost no motion, and the ankle was swollen about twice the size of the other ankle. And he proceeded to tell me during the exam that he had fractured his ankle in 3 places, and he had ankle surgery in the beginning of April and had been doing physical therapy, and they were struggling with getting the inflammation out of his ankle and, of course, getting rid of the pain, and walking with a limp had flared up his low back. So talked to him a little bit about the laser, and I said, the laser will knock that swelling right out of there. So we put him on spinal decompression, and of course, Janet stretched him and I adjusted. I mean, we did, I think, 4 minutes of laser on that ankle the first day. So he comes in a day later, they were going out of town for the week, and he came in for me to pretty much patch him up on his low back so he could do some traveling. And he came in the next day, and his low back was better. The ankle was about half the size of it was that first day he came in. So we lasered it again, and he said, I'm walking so much better. And even my wife noticed how much better I was walking, how much better I was feeling. So he said, I've got physical therapy coming up in the next couple of days, and I'm purposely not going to tell the physical therapist that I had done anything to my ankle just to see what they notice. So he goes in for his PT session, and they look at his ankle, and the first thing they said, what in the world did you do? We've been trying to get the swelling down since April, and we've been banging our head against the wall. And he said, I went down and got worked on from my low back, and Dr. Bull put some of that class 4 laser on there. So just in 3 treatments, we have knocked out
He's definitely a fan. He's a huge fan of the laser. That
laser impresses me every day. So that's something that I thought was pretty interesting. Another interesting patient that came back in yesterday, as a matter of fact, and we hadn't seen her for probably about a year, but she was coming in to us initially for migraine headaches. And we got rid of the migraine headaches over probably a 6-week period. And one of the things I really stress to our patients is maintenance care. Once we get you fixed, I tell my patients, if you'll see me once a month, you won't have any more issues unless you do something really silly. It keeps the body moving like it's supposed to. It keeps the nervous system interference off of the nerves so the body can function like God designed. And she came in, she got rid of her headaches. We didn't see her for a year, so evidently the headaches came back. So the neurologist recommended that she get Botox injections. Now, Botox, if you're not familiar with it, is botulism. So basically they inject, she said they did 72 injections of botulism across her forehead, in her neck, and at the base of the skull. So it seems to me that coming in and getting a pretty simple adjustment once a month is better than getting 70 needles in the head. But sometimes it takes, patients will have to go down a difficult, bumpy road before they finally realize. So she said the Botox helped a little bit with her headaches, but I think she decided that doing the once a month treatment. So she was back in yesterday, and we worked on her neck and worked on her muscles. But that reminded me, Janet, you remember the patient we had in South Carolina that had Parkinson's.
Yes.
And she came in to see us for her Parkinson's and to help her with balance. And we helped her with that. Well, she had already had the botulism injection scheduled, so she went ahead and did that anyway.
First of all, I don't think we realized, because it's like she came in, so with Parkinson's, she already had head forward posture. So we're working and we're getting her better. Well, she missed a couple appointments, and I kept trying to call her, and I never could get her. So then we finally got her. She came in, and I think she had already had it scheduled, probably.
Right, absolutely.
But I wasn't. Dr. Bull might have been aware of it. I wasn't aware of it. So we finally got her back in. So she walks through the door.
She comes in. This was probably 3 months after she had the injections done.
Right.
Now, they injected the base of her skull, and I don't know if they did the procedure wrong or if they overdid it, but she told us that she was unable to lift her chin off of her chest after they did those injections for 2 months, because the botulism essentially deactivates the muscle's ability to contract. So she couldn't lift her head up. Now, can you imagine not being able to lift your head up for 2 months? So there's a much simpler solution out there, folks, to get rid of your headaches, and it all has to do with head forward posture and how it affects the muscles on the anterior part of the neck. And we've done shows about it in the past, and how those anterior muscles attach at the base of the skull, and it's that attachment at the base of the skull that initiate the headache. So if
Well, it's like you were telling her, with her head forward posture, the ones on the back were already overstretched. It was the ones on the front that were shortened.
absolutely,
So if they were going to do it, they needed to have done it in the front,
in the anterior,
to relax those muscles,
absolutely,
to pull her head back.
takes pressure off the brainstem.
Right.
So some good things in the future for her. Also, another interesting patient, a Vietnam vet that came in. I think I mentioned him on some previous shows. Came in initially for his low back pain, extreme exposure to Agent Orange, and a insulin dependent with a pump diabetic. Had already had some toes amputated on both feet because of the issues with diabetes, but also had severe peripheral neuropathy. So he came in, we got his low back straightened out. Now we're starting to work on his peripheral neuropathy, and he had his, fourth treatment today, Janet?
Today was 4, so 3, and after the third one, we'll do an exam.
Yeah, we've rechecked those areas of sensory loss, and he is doing incredibly well. He's walking so much better, his balance is better. So good things in the future for him, and that is all.
He's excited.
Oh, yeah. He's doing incredible. Just when he first came in, he couldn't walk probably 100 yards, and now he's walking, I think he's over a mile a day, and that's in a 6-week period. So pretty incredible with that laser.
He was a referral from the surgery
centers from across the bay.
Yeah.
Yeah, so he's doing incredibly well. So just a minute. Oh, our 26-year-old that we talked about on the last show, and that he was actually the topic of our last show. We talked about hyperactivity of the autonomic or the automatic nervous system. Came up to visit us for 2 weeks from South Carolina. Had seen 5 specialists down there for his pain and disability, and had seen a chiropractor also, and they weren't able to help him. So over a 2-week period, his pain level in his low back went from an average of a 9 or 10, even at rest, and it was a 4 or 5 when he left us last Friday. So sent him back to South Carolina, sent him with some instructions for a chiropractor down there that has a decompression table on how to treat him, and we'll do some follow-up laser on him in about a month or so. So I fully anticipate that a 26-year-old kid that had not been able to work for the past year because of pain levels or not of a 9 or 10 with no help, in 2 weeks' time we got him down to a 4 or 5. So I fully anticipate over the next 3 months we will eliminate probably 90% of his little bit of pain that he's got left, and he will go back to work and lead a normal, productive life, and he'll certainly have a better quality of life. So some pretty interesting things going on in their office. Now I'm just going to dive into back pain and disc pain, and we'll start with some interesting statistics. Prevalence of disc issues. About 80% of people in general in America will experience debilitating back pain at least once in their life. 80%, and debilitating back pain is probably the most prevalent injury in workman's comp claims. So it's a pretty big health problem. Tissues primarily responsible for generating spinal pain include muscles, facet joints. As we've talked in previous shows, facet joints are basically the bony articular surfaces of the spine. Sacroiliac joints, we've done shows on people with SI joint pain, and intervertebral disc, spinal nerve roots, which are generally greatly affected by the health of the disc. So all these factors are really set up by chronic inflammation, and that's what we're going to be talking a whole lot about today, is chronic inflammation set up by issues with the vertebral disc, and it manifests as what they call discogenic pain, or pain caused by issues with the disc. The discs also cause radicular pain, which is basically sciatica, pain that's referred down the leg by the unhealthiness and the chronic inflammation set up by the disc. So just some interesting statistics here. Sacroiliac joint pain is about 20% of back pain issues. Facet joint pain, 50 to 40%. I think it's more closer to 15%, but primary disc pain, 40%. 40% of back pain comes primarily from the disc. So let's talk a little bit about how God designed our disc. God designed our disc the way I describe it to patients. Think of the disc, it's like the tire on a vehicle. The tire has an outer skin, and it contains air. Well, the disc has an outer skin, and that outer skin is called the annulus fibrosus. And the outer skin of the disc is very strong. It's when that outer disc becomes weak that people actually get a disc bulge, or what some people refer to as a slip disc, or what some people refer to as disc herniation, where the disc material actually comes out of the disc. So the outer casing of the disc is called the annulus fibrosus. The material in the disc, and it's just like air in the tire, well, the material in the disc is called the nucleus pulposus. Now, the nucleus pulposus is made up of a protein called a proteoglycan, but it's just a fancy word for a type of protein that has collagen in it, and that inner disc material is 80% water-based. So when we're doing spinal decompression on a patient, we tell them emphatically you need to drink at least a gallon of water a day, because the disc, as the disc becomes healthy again, you need that water base. So the inner disc material, nucleus pulposus, outer disc covering or lining is called the annulus fibrosus. And another important part of the disc is what they call the vertebral end plate, and that encompasses the bone, which has, or the vertebrae itself, which has a high vascular or a lot of blood vessels. And those blood vessels we've talked about on previous shows, the imbibition process, the process of forcing nutrients into that disc. So the vertebral end plate is the important part of that disc that actually allows the vascular system, the blood, to replenish that water base, to replenish nutrients and fluids. And those nutrients and fluids, as we're going to talk about today, a lot of those are encompassed in a proper diet. So the disc biology, the disc health, the health of the disc really comes from number one, what you eat, and number two, as we've talked about in previous shows, motion. God designed every joint in our body to move, to have motion, and that motion forces nutrients into that disc via that vertebral end plate and via that imbibition process. So health of that disc comes from how well your spine moves, and that's exactly what I do as a chiropractor. When I adjust the spine, I am restoring motion to those vertebral segments, and restoring motion allows that imbibition process to take effect. And a good way to describe that imbibition process of forcing nutrients and forcing fluids into that disc is just like how a sponge takes up water. It absorbs it. So a healthy spinal segment that's moving properly, that has not had trauma, that has proper nutrition, will absorb those nutrients and will absorb that fluid just like a sponge. And the material in that disc, that nucleus pulposus, is designed to utilize that water and utilize those nutrients. And Charlie, here's an interesting statistic. I was taught that it's actually about an inch, but approximately 2 centimeters. If while you're sleeping at night, that disc replenishes, and your body inflames at night, your body heals at night, your discs of your spine actually grow. You gain about 2 centimeters of height while you're sleeping. So when you get up in the morning, this is pretty interesting, you're anywhere from 2 centimeters taller to an inch taller And as the day progresses and you spend time on your feet, you compress those discs, you force some of those nutrients out. So that imbibition process is very necessary to maintain health of the spine, to maintain motion of the spine. There was a study done, in one study, avoiding AM flexion, which means in the morning, avoiding bending forward at the waist, led to a significant reduction in low back pain versus control studies. So if you get up in the morning and you're bending forward and you're doing that forward flexion, you are adversely affecting motion of the spine. You are adversely affecting those discs' ability to maintain that nucleus, the health of that nucleus pulposus. So I thought that was pretty interesting. A lot of people get up in the morning and do some exercises. So if you're getting up in the morning and doing sit-ups or bending forward at the waist, you are adversely affecting the health of the disc. I thought that was pretty interesting.
Don't do the head, shoulders, knees, and toes.
Absolutely.
When you wake up.
That's right. Wait till the afternoon to do it.
Life gets more complicated every day.
I know.
There's always something you can't do or eat.
We need post-it everywhere. Do not do this in the morning.
Absolutely. So proper motion in the spine, proper nutrients from eating, we're going to talk more about that, really enables your spine to be more flexible, really enables your discs to support body weight, to support gravity, to support lifting loads of the spine. If you have a job that's very physical oriented and you have to do a lot of lifting, the health of those discs is imperative for you to do your job. So the center of the disc, the nucleus of the discs, primarily receives its nutrients via that imbibition process from the vascular system at the end plates. And this is why I've talked a lot about trauma. A lot of the spine issues that we work on our patients, and I tell guys all the time, things that we did in our teens and early 20s affect our spine later on. So a lot of those physical trauma type issues, football, dirt bikes, car accidents, wrestling, a lot of the things that we did when we were teenagers, we thought were indestructible. That trauma affects motion of the spine. That trauma affects that imbibition process, the process of your spine being able to get those nutrients and get that water balance back in that disc and maintain the health. So the pathological process of degradation of a disc, the disc actually breaking down and degrading, most people associate, have patients come in all the time. Well, my back, over the years, I'd get cases of back flare-ups and I'd hurt for a couple of days, but this time I bent over and picked something up and my disc went out. Well, really, in reality, the structural issue and the chemical process that caused that disc to degrade started years ago. It's not normally really associated truly with bending over and picking up that pencil or that piece of paper. That's what may have brought the severe symptoms on, but the degrading process of that disc really started years before that, and it starts at that vertebral end plate. Damage to that end plate, repetitive micro trauma, football players, impact after impact after impact, disrupts that environment of the vertebral end plate, the nucleus's ability to get those nutrients and fluids, and that sets off a process. You know, every cell in the body has what they call fibroblasts that build new cells, that build new material, and you have osteoclasts that destroy. Well, chronic inflammation from a poor diet, trauma, it can be stress, it can be emotional stress, sets off that chronic inflammation, and that chronic inflammation starts those osteoclasts, the type of cell that destroys tissue. Those cells lose the ability to turn themselves off, so your body starts destroying the inside of that disc, and the inflammation process your body's not able to turn it off. So it takes that strong disc material, the nucleus pulposus inside of the disc becomes very acidic, becomes very unhealthy, and the disc starts to eat itself up from the inside out, and that's where disc herniations, that's where disc bulges come from. The inside of the disc becomes very unhealthy. It becomes very acidic. It basically eats a hole on the inside of the disc, just like people that have stomach ulcers. Your body eats a hole in the stomach. Well, because of poor diet, because of lack of proper nutrition, because of lack of proper motion in the spine, your disc starts to eat itself up from the inside. And people that have issues with disc problems over the years, and they take medications and they get injections, the injections temporarily get rid of the inflammation, but it does not address or restore proper motion of the vertebral segment. It does not restore that good, healthy chemical balance, that good pro-diet balance that sets up that chronic inflammation. And surgery is not effective. You know, if you have a disc material that's out of the disc and they go in and do surgery and trim that disc, that does nothing to restore that good homeostasis, that good chemistry in the body. So the key really to today's show is I want to talk more about, at this point, how nutrition affects that good chemical balance in the disc and in the body as a whole. So first, I want to talk about the average American's diet contains 60% of calories coming from sugar, flour, and refined oils. 60% of our diet comes from sugar and simple carbohydrate. Now, that simple carbohydrate and that sugar affects the chemical balance in the body. The body does not respond well to simple carbohydrates and sugar, and it sets off that chronic inflammation process. Now, that chronic inflammation process is a systemic thing. It affects the whole body. That's why a lot of our patients, we will put them on a gluten-free diet. Gluten-free diet eliminates sugar. It eliminates simple carbohydrates. It eliminates refined flour, a lot of those refined oils. And a lot of those refined oils are corn, safflower, sunflower, cottonseed, soybean oils, which are bad for your body from a inflammation standpoint. So eating poorly triggers your immune system to set off that chronic inflammation. That chronic inflammation activates those osteoclasts, which break down tissue. And on a daily basis, those osteoclasts are activated. They can't turn off. So it triggers your body, the inflammation process, to start destroying its own discs. Your body is destroying its own spinal tissue, and you start destroying those discs. It starts to irritate the nerve roots. You get the sciatica, you get the sacroiliitis, and it's all greatly affected by what we eat. Now, it's interesting that, and this ties in directly with what we're talking about, but diabetics have a higher incidence of back pain, and people with poor diets, and it ties in exactly with what we've been talking about: eating properly, eating better. I had diabetic in that we were doing some laser treatment for his peripheral neuropathy, and he had an episode, a hypoglycemic episode, where his blood sugar crashed, and I had to go get him a couple Cokes just to get his blood sugar up so he could actually stand up. And I asked him, I said, "What did you have for breakfast this morning, or what do you normally have for breakfast?" And he said, "I had cereal and milk," and he said, "That's usually what I have, or I have some type of oatmeal." And I said, "Well, do you realize that you're eating sugar, you're eating simple carbohydrate, your body breaks that down quickly. That triggers a high glucose, a high sugar content to be put into your bloodstream very quickly. That causes your insulin level to spike. Your body stores that sugar very quickly, and then you crash just like you just did. I said the proper way, and I can't believe that somebody that is insulin dependent on a pump has never been taught. Diabetic to begin with, any type of diabetic, even if you're not diabetic, every 2 to 3 hours, small portions, and you need protein in your diet. Diabetics respond much better to protein because you don't flood your bloodstream with insulin. Your pancreas does not overproduce insulin. You don't store it quickly, and you will not crash. So I told this patient, you need to have some eggs, you need to have some bacon, you need some protein first thing in the morning, and then every couple hours graze on a little protein, and you won't have that crash. So
what I've found is you keep a jar of peanut butter handy at work or whatever.
Absolutely.
And just eat a tablespoon of peanut butter.
Absolutely.
Yeah.
Keeps that.
And that
yes, makes a huge
does two
difference.
things. If you're on a diet, if you will, trying to control your weight, that if you get hungry in the middle of the morning, in the middle of the afternoon, that takes care of it.
It satiates.
Exactly.
Absolutely.
Yeah.
It satiates. Small portions frequently, but incorporate protein. So I told him, bump your protein intake up, cut back on your simple carbohydrates, cut back on your sugar, and he has done much better. And that really ties in with today's study. Foods that we eat set off that chronic inflammatory phase. That chronic inflammatory phase has negative effects on how the body functions from a systemic level, from a digestive level, from the health of the disc level. So getting back to this NutriDisc supplement, looking at some of the ingredients in it, chondroitin sulfate, glucosamine sulfate, two substances that your body uses to produce new tissue. Turmeric is an excellent has excellent anti-inflammatory properties. It also has enzymes that help make new tissue. It has enzymes that stop the overproduction of the osteoclast. It has curcumin. Curcumin is an excellent herb that has healing properties. So the emphasis of today's show is get your monthly adjustment, maintain motion in your spine, and look at what you're eating. What you're eating greatly affects your long-term health, besides having an issue with, I know obesity here on the Eastern Shore, that rate is pretty high, but what you eat on a daily basis not only affects your heart and can make you fat, but it also affects the health of the discs. It sets off that, as we've had many shows on chronic inflammation, it sets off that chronic inflammatory phase. That chronic inflammatory phase causes the cells that destroy tissue in your body to become overactive. They can't turn themselves off. Starts to eat the disc, starts to affect the health of the disc, and then comes the disc herniations, the spinal stenosis, the sciatica, the sacroiliitis. So all these disorders that Janet and I work with on a daily basis are greatly affected by not only motion of the spine, but food that we eat. So chronic inflammation is really being tied to a lot of disorders affecting the spine and affecting the whole body.
Okay. That sounds very interesting. So change your diet and
Absolutely.
Come in and
get it
taken care of.
Get a tune-up once a month and eat better, and you'll have quality of life in your retirement years.
Okay.
All right. Give us a call, 331-1190, or you can email us if you have any questions, Bayside Chiropractic of CC at gmail.com. And also check us out on Facebook.
Absolutely.
We're putting up videos of our patients
We
and
post
updates.
on a weekly basis.
Yes.
Some pretty interesting patient testimonials on there.
And you can message us on Facebook too.
What's our
Awesome.
Facebook page, Janet?
Bayside Chiropractic, Rehab, and Laser. And I think there's 2 of them, but of course the one in Cape Charles will pop that up.
In Cape Charles. That's the one.
Make sure it's Cape Charles.
That might be somewhere else in the world.
There's there's another one or 2 out there.
All right, Dr. Ed and Janet Bull. We'll see you in a couple of weeks.
Great. Thank you, Charlie.
Thank you for listening to Shore Talk. This interview has been recorded and is available on WESR's YouTube page. To schedule a Shore Talk for your community event or organization, call us at 757-787-3200 or email Nancy at WESR.net.